Hi, this is Dr. Y. I am a behavioral health doctor and a licensed clinician, and this is part 3 of what you need to know about trauma. I got so many requests about trauma that I decided to do an entire month of trauma videos just for you, but I'm having to break them down. So this is part 3, and this is really about how trauma and experiences of tragedy can show up with our mental health. Trauma impacts everything that we do, by the way. Mind and body. Just want to throw that out there. And we really don't have much control about how the limbic system of our brain, that amygdala system of our brain, is going to respond to trauma. But there are some things that we can do to treat it. Now, one of those things is understanding from the get-go how it can show up in our mental health. So let me run through 10 different criteria that I want you to think about. They can also be experiences, maybe even behaviors, and I want you to think about it. If this is something that you're struggling with, you want more information, write it down below. I'd be happy to pass along any information that you might need. Okay, so number 1, and these again are common mental health effects of trauma, okay? Number 1 is flashbacks. Now, we most often think about flashbacks when we think about trauma or PTSD, don't we? And it's really reliving some aspect of the traumatic event and feeling like it is happening now, even though it is not. So we get triggered by something, and then our body goes through remembering and reliving that event. And it feels real, folks. So this is not somebody just making it up, or they're being weak, or they're being overdramatic. It really is real. Okay, number 2 is panic attacks, all right? So this is a type of fear response. And really, a panic attack is like your body's exaggeration of the response to danger, stress, or excitement, okay? So it's over-responding. The anxiety center of your brain, which is the limbic system of your brain, is having a heightened response to any of those stressors. And even though what's going on around the patient may not necessarily be dramatic or chaotic or dangerous to other people, that is not the way their body is perceiving it. So they're having true symptoms according to what they're reading the environment to be. Does that make sense? Number 3 is dissociation. Okay, so what is dissociation? It's one way that your mind copes with overwhelming stress. That's what it does. So what will happen is you might feel numb, spaced out, detached from your body. You may black out even. You may also faint. There are different ways that the body perceives overwhelming stress, and dissociation is one of them. Number 4 is hyperarousal. You also may have heard the word hypervigilant. So feeling very anxious or on edge and the inability on your own to relax. Okay, so what that means is the limbic system of your brain has experienced a traumatic event and it's always on high alert. In a brain that has not experienced tragedy or trauma, the limbic system is doing what it's supposed to be doing. It alerts you when there's danger, it responds appropriately when there's danger, and then it's able to calm itself down when you're out of danger. Well, for somebody that has experienced trauma, that's not how the brain works. There's this thing called hyperarousal, where whether you are in danger or chaos or a tragic environment or not, your limbic system of your brain, because of that former trauma, is on high alert all the time. It's up here. And your ability to calm that down is very, very difficult. So it's exhausting, mentally, physically, emotionally, and frankly, spiritually. Okay, the 5th one is sleep problems. You may find it hard to fall or stay asleep. You may also have feelings of being unsafe at night, or feeling anxious or afraid or having nightmares. All of this is normal symptoms once you have experienced a tragedy or a trauma. It really, really is. And so it's something to talk to a professional about. The 6th one is low self-esteem. So trauma can affect the way you value and perceive yourself. especially if we're talking about sexual assault or intimate partner violence or even bullying. These types of traumas can absolutely attack a person's value, their self-worth, and can often lead to suicidal ideation. So this is something that we don't want to leave alone. We definitely want to have and seek treatment for these types of thoughts. So number 7 is grief. I think that there are different things that people grieve over. Sometimes it's the loss of a person. Sometimes it's the loss of your health. Sometimes it's the loss of financial security. You see where I'm going with this? There are a lot of big tragedies and traumas that happen in a person's life that are surrounding grief and loss. So experiencing that loss can be traumatic, and then how that loss has changed their life can be traumatic. Sometimes you can go back and rebuild those pieces of a person's life. Sometimes you can't. And so that experience of loss is the trauma. Think about the COVID pandemic. What did you lose because of the COVID pandemic? I mean, honestly, it wasn't something that happened overnight, and it wasn't something that vanished overnight. In fact, we're still dealing with the COVID-19 pandemic in a lot of different ways, aren't we? And so that is a long-term trauma. I'm just putting it out there into the universe right now. It's a long-term trauma, okay? There is grief and loss associated with the COVID-19 pandemic. Some people actually lost a loved one through that experience, but we collectively and individually lost more than that. Okay, number 8 is self-harm. So self-harm is a way of coping with hurt. Okay, this could include harming parts of your body that were attacked or injured during the trauma. Yeah, and for people who do not understand trauma or how trauma works, it doesn't logically make sense, right? I have a lot of parents that ask me about self-harm in terms of trauma or tragedy with their children. This is where you're going to need professional help. What I would tell you with our children and our adolescents is that we as parents need to be vigilant. We need to be talking with them, asking questions, and providing resources for them, depending upon how they're coping with a trauma. I think it's really important too, as a parent, I'm a parent, to be plugged in and engaged with what our kids are experiencing. Many times they are not going to tell you. And that doesn't even mean you're a bad parent, okay? That's not what I'm saying. It's just that kids in their development usually will tell a friend. Sometimes they'll tell a teacher or another trusted individual in their life, a coach, before they tell their parent. And many times that's out of fear. We need to be engaged and checked in, because these traumatic events can lead to very severe mental health symptomology in children and in adolescents. So check into that. So number 9 is suicidal feelings. Yes, trauma can lead to suicidal ideation and thoughts, especially when we're talking about untreated trauma. And remember what I talked about on number 8, tuning in with your children and your adolescents. This is particularly true with a kid. And let me tell you why. It's because, number 1, they're in a particular development cycle, so their brain isn't fully developed, nor do they have all the coping skills to be able to handle the big picture coping that needs to happen with a traumatic event. Number 2, they are not in a position of power. Kids, by virtue of the way that our system is set up, are not in authority. They don't have a voice. And so we as parents and community leaders have to check in with our youth and make sure that they are coping. Make sure that they have resources. Make sure that they have support. Make sure they have somebody to talk to. I made a video not too long ago about school shootings and what parents can do with some resources about that. So that is a particular trauma example of what we can do as parents and as community leaders to check in with our kids. What we're trying to do is tap into those kids that are being preoccupied with thoughts of ending their life. They're thinking about it, they're making plans. If you're wondering where they're getting those ideas, it's from their peers. It's on the internet. It's in the computer that they have that's in their back pocket. Okay? Please do not think or be naive into thinking that this is something that teenagers don't talk about. They do talk about it. So we as parents, need to be talking about it with them. And in particular, if your child has gone through a traumatic event or some big change that can be perceived as a traumatic event, talk with them about it and make sure that they're okay. Okay, number 10, the last one for this video is alcohol and substance use. Yep, this is how it can show up with our mental health. And a lot of people will use alcohol or substances to cope with the feelings, the aftermath of a trauma. What I'm going to tell you is every substance you put into your body will not help. It will make it worse. It may help the first time that you use it, but if you are using consistently alcohol or substances, you are not fixing the problem. You are not even coping with the problem. You are masking the problem. And by the way, trauma doesn't go away because we're drinking or using something to get it to go away. Basically, what we're doing is we're numbing out the uncomfortable or the anxious feelings that we're having about that traumatic event. The use of substances is going to change and alter your brain chemistry. That's what happens when you use substances. And it will make the balance of those brain chemicals worse, as well as your symptomology related to the traumatic event worse. It worsens everything, folks. So don't go to substance use. Please don't use alcohol. Don't use any of these other substances. Deal with it free and sober. Find a professional that can help you work through those traumatic experiences without putting extra substances in your body. Okay, so those are my top 10 ways that trauma shows up in our mental health. And by the way, this can be for adults or children. So I want you to be aware of that. I also want you to know that there's resources. I'm going to put these resources in each one of these trauma videos so that you can have other places where you can go and visit for more information. If you have more questions now, because you've watched video 1, 2, and 3, type them down below. I'm happy to give more resources and more information as it comes in. Thank you so much for watching, and don't forget to like and subscribe. Video 4, it's coming up.